Hi, beautiful people. How are ya? I hope you're having a great day. So, today, I want to get into the things that were confusing me originally in part one and gain more knowledge about this condition, central pain syndrome. When I'm researching a topic, a new topic, I can easily get overwhelmed and confused when there are many different definitions and terms used to describe that topic or that condition. And it was no different while researching this topic. When I did part one of central pain syndrome, that's what occurred. And so I chose to just do a basic understanding of the topic so, we could just have an overall understanding of what central pain syndrome is, but I didn't really do a deep dive. I mean, I'd never heard of central pain syndrome. So I'm assuming many of you haven't either. And again, I'll use CPS for central pain syndrome so I don't have to keep saying that over again. So I hope you enjoy this topic. One of those things that confused me was the many terms used to describe central pain syndrome. And these are some of the other known names for central pain syndrome or CPS: central neuropathic pain, central post-stroke pain, multiple sclerosis related pain, and spinal cord injury related pain, centralized pain, central pain, central sensitization, and widespread or diffuse pain. Central sensitization is when the nervous system goes through a process called windup and gets regulated in a persistent state of high reactivity. Pain is maintained by this process and remains even after the initial insult occurs, meaning after the injury or illness occurs. I understand why they use the term central sensitization, but there are other illnesses that fall under the central sensitization syndrome umbrella. Fibromyalgia is one of them, as well as ME/CFS, IBS, vulvodynia, myofascial pain syndrome, restless legs, temporomandibular joint disorder, and dysmenorrhea. None of these are psychiatric illnesses, although issues like anxiety and depression are common among patients who have these disorders. But I think that it won't be long before fibromyalgia and ME/CFS will be in a category all on their own because, for one, fibro is showing some peripheral dysfunctions. Paresthesias are common, which are normally considered a peripheral nerve issue. And ME/CFS has shown immune system abnormalities and is believed to be caused by an infection like Epstein-Barr virus. But like fibro, there are other causes as well. So you can see why this can initially be quite confusing. My goal is to unwrap this complex illness and make it easier for us to understand. On top of that, I've seen CPS described online as neurological and also neuropathic. And we learned in this video that they're not the same thing. According to researchers, CPS is a neuropathic pain that has localized to the central nervous system. But any central pain state can have a component of peripheral pain like peripheral neuropathy and fibromyalgia. I I feel like when I first started studying fibromyalgia, there weren't all of these confusing similar terms. I'm sure there were, but then again, I wasn't looking for them. I was single handedly concerned and focused on just fibromyalgia. Chronic pain syndrome is simply when pain doesn't go away from an injury, infection, or illness after 3 months following the body's restoration to a healthy state. Chronic pain syndrome can occur following the onset of fibromyalgia, shingles, diabetic neuropathy, peripheral neuropathy, spinal cord injuries, stroke, radiculopathy, pelvic pain, migraine, osteoarthritis, rheumatoid arthritis, lower back pain, an accident, sickle cell anemia, or autoimmune conditions, Epstein-Barr virus, or surgical trauma. And although these conditions are similar, that is fibro and CPS, they're not. For most people, the initial condition improves through medications or other therapies, and the pain stops or lowers significantly. I mean, that's what happened to me. I wasn't healed, but medication did help, and I was able to function. I went from an 8 to a 3. However, some individuals continue to experience severe chronic pain. Okay, so let's stop for a moment. Isn't that the exact definition of fibro? Chronic pain that lasts for 3 months or more? Well, fibro, on the other hand, is widespread. Well, CPS can be widespread too. And in fibro, there are other issues like stiffness and fatigue, et cetera, et cetera. But still, why add another term? I don't know. I didn't study medicine, I studied psychology, but then I get it when you think of it from the standpoint of 20% of people with osteoarthritis, for example, who get a knee replacement and then still have chronic pain after surgery is very confusing. The surgery should have corrected the knee pain, yet that doesn't happen for many people. They go on to develop central pain syndrome. Some people may experience constant pain while others experience flares or intense pain that subside to a lesser pain. Those chronic pain conditions are what can move on to CPS months or years after, including after an injury. So it's like you're getting a double or triple whammy. On top of the chronic pain, pain is accompanied by depression, anxiety that interferes with daily life. As I'm diving into this illness, I begin to get the idea that it's believed that there is both a physical and mental aspect to CSP. So the physical is a central sensitization. Then the mental can be any number of things. But before I dive into this, let's remember there's no shame involved or allowed. And we should never feel like there's something wrong with us when there are psychological issues going on. First, 1 in 5 Americans have a mental health condition. That's the ones that admit to it. So it's very common, but often people never talk about it because of the stigma involved. So let's be proud of who we are and know that we're beautiful. It's believed that the system of nerves and glands that handle stress may be the cause of the pain. That's one theory. And people who already suffer from one mental health condition like major depression are likely to get CPS. Symptoms like anxiety, depression, irritability, guilt, and job loss are also common. So, after looking at all of this, I was still confused. So, I was reading an article, Mayo Clinic Proceedings, and the writers stated that there is a distinction between central neuropathic pain and central sensitization. Amen to that. That makes sense. So I guess all of those other writers had it all wrong and they were mixing it all up together, making it confusing for the rest of us. And so in this article that I was reading, it says that we should not confuse central sensitization with central neuropathic pain. So here's what I believe that I've been able to pull together so far. I think this will help us to understand a little better. At least it's helping me. CPS, central pain syndrome, can have a neuropathic origin in which the pain results from a central nervous system injury like MS or stroke, or it can have a central sensitization origin like with fibromyalgia. Now that makes sense. Rather than it all being blurred in together, it can have different origins. So I'll end here with part 2. Part 3 will be out in a few days. I hope you learned something. I send you gentle hugs and support. Love you.